So I'm Julie Grutzmacher. I'm the Director of Patient Advocacy at Prevent Blindness.
Hi everyone, I'm Patricia, and I'm the Chief Research Officer at the Chicago Lighthouse.
Hello everyone, I'm Bryant. I am the Chief Operating Officer for Triage.
And I'm Tasha, Lockridge, Associate Director for IT Services at Prevent Blindness.
Let's get started with that. We'll start with you, Tasha, first. So you were diagnosed with diabetes about a year ago. So you want to tell us a little bit about your journey, what were your symptoms, what was going on in your life at that time, what were your symptoms, maybe even the impact to your eyes, and then what did you do about it?
So I was diagnosed in July last year, and I had been previously diagnosed with diabetes. So I held on to that type of for a time, and sometimes when you get that diagnosis and create something kind of they attempt to show it kind of can pass along. So I was pre-diabetic for a very long time, and until I started just generally not feeling well. When I was out on vacation with some friends, and a friend of mine noticed that I had lost a few weight, and I'm thinking, oh yeah, I just took a few pounds, but later on, I found out it was a significant amount of weight. I lost about 30 pounds in 6 weeks. And it's because I wasn't eating. One of the symptoms of diabetes is you feel thirsty a lot, so I didn't want to eat anything. I just wanted to try to drink water, just constantly those again, and going to the restaurant when I was eating, so I lost a lot of that. And so it was in a low environment. I was on vacation in New Orleans, and like some of these hot days like this, and I was miserable. When I was just sweating and just couldn't be free and just constantly running up water. So I came home and I went to the doctor, and I'm thinking, oh, I was just hot, whatever. And so I did reach to the doctor without to go back. So he pricked my finger, and my sugar level was like 432. So it was
Remind us what the normal range is.
The normal range, according to my doctor, is between 89 and I want to say 120 or something like that. So I was very much exceeded past now, and so I really expected him to kind of send me to re-emergency room or give me some type of answer or something. But basically, he did like kind of the general medications and things like that. And, yeah, so I started taking the medicine, and we had to make some adjustments with that a little bit. As far as my eyesight went, that happened later. Like I had all the whole symptoms, but my vision got really bad because until I got that high number down, it stayed really bad, so I came down from the ability to. I really had to check my numbers, not only every day, but several times a day, just to make sure that I was, doing everything that I told me to do. So finally, I started having to wear glasses. I wear glasses normally, but I had to wear like extra baggies kind of glasses, like readers. I had to get the top number of all the readers, and I had to start wearing those every day. But as I continued to take my medicine, my vision kept that. I started one-stop ophthalmologist, and I wanted to get some new glasses. And he's like, yeah, no, the sugar is gonna go down. And I wasn't so taking one down. I'm like, it's not gonna go down, it's not in my eyes, it's gonna go, whatever. It's just like, yeah, just take it easy, take your medicine, and that's what happened. I calmed down, took my medicine, and my vision got back with their wife.
Yeah, so that the importance of keeping energy in your blood glucose level to keep your vision, less blurry, perhaps. Were there any resources in particular that helped you along your way? It sounds like that was a major life transition for you. Perhaps the learning curve, but you didn't know anybody who were had diabetes. And so tell us a little bit about what helped you along the way.
So having a relationship with your doctor, this particular doctor, I had to just kind of establish a relationship, because sometimes I understand that doctors kind of get it, it's just a diagnosis, and it's just something that they diagnose people with all day, every day. So they kind of take a nonchalant, at least my doctor, not all doctors, but it was very nonchalant about how it was like, okay, take this medicine, how many times a day should you take it, and it was just, after I told him what I needed him to know and how I felt about his dog to be. how to handle diagnosis, began to kind of slow down and explain to me what the possibilities are. Like, what happens if I don't take care of this, take care of my diabetes? What can happen? What is it? What's the extreme? What can I do? So it's like, you have to exercise, you have to watch your diet. You also refer to a dietitian, so that's very important. And the other resources is, of course, like to prevent blindness. I work in preventing blindness, so I had also at my fingertips to kind of to read up more and get educated about it. We have a lot of fact sheets. You see this, a lot of our website is excellent and it's full of information about many things. So it's really helpful.
Thank you so much. This is such a great example of self-advocacy. So I want to turn to, let's turn to you next, Patricia, Dr. Grant. If you could talk a little bit about advocacy, perhaps for self or others related to like mental health. I know also you're at Chicago Lighthouse have done a lot of work around diabetes education also. So anything that you want to share about sort of lessons learned with regards to that? Great, thank you. So as I said before, I'm from the Chicago Lighthouse and we're located in Chicago. We're a nonprofit organization. We provide services to people who are blind or severe, otherwise disabled, and veterans. And one of the services that we've provided is a diabetes prevention program. And that is modeled after the National Diabetes Prevention Program. And that is really the goal is to prevent diabetes. And we bring people who have prediabetes, and we've learned that 1 in 3 people have prediabetes. And a lot of people don't know that they have prediabetes. It's really not a good measure to test whether you have prediabetes. So often what happens is someone doesn't know, and then we just trigger up a very bad account of what can happen. But we work with people on nutrition, on exercise, on just really awareness, on building a relationship with the doctor. How do you ask the right questions? But one area, and we are modeled after the National Diabetes Prevention Program, but we learned that vision was never mentioned at all in the year of the program. There are no recommendations on how to manage your vision, how to check your vision, or even what can happen with vision. And that's very alarming because diabetic retinopathy, which is a diabetes-related eye condition, that is a leading cause of blindness, and it's the leading cause of preventable blindness. So it was very alarming to see that there is no education from vision now. So we really took that as an opportunity to start integrating that into our program. And then another area that we saw was unaddressed is mental health. And if you are a person who is even facing a chronic illness and you have to manage your eating, your exercise, just really behavioral changes, if you're not quite ready mentally, how do you approach all of that? It could be very difficult. So that was another area that we started to integrate into our program, is having psychologists come in and speak about how to make these changes, because they're not easy. And I think the perception is like, to start exercising, to start eating better. And it's just like, well, if it was that easy, we'd all do it. So it's obviously not easy to do, and support goes a long way. So now we are addressing mental health even in a bigger way, and we have a program, the Stronger Together programming. We're addressing mental health in all different areas of our work, in employment, and education, and low vision clinic services, because again, if you're facing something with vision loss, or you're facing something like a chronic illness, it really does help to kind of talk about, or even to be in the support group and kind of talk about these things. So we think this is a really important area, and we always say that mental health matters as much as physical health matters. And if you're really not taking care of yourself, if you're not addressing your mental health, then you should tell with other illnesses that you can Thank you, Tasha. I think that is such a wonderful transition into burn the importance of addressing mental health, alongside physical health. Monica, tell us about Triage and all of the services that you've done, your role there, the history there, anything you want to share.
Sure. So at Triage Health, we provide free education on all of the little and practical things that can help after a serious medical diagnosis. And oftentimes when I tell someone, I'm a healthcare rights attorney, they will look back at me and say, what's that? Or what's legal about healthcare? And the reality is almost everything.
from what medications we have access to what health insurance has to cover, to what rights and have our work, whether we're working through treatment, or we need to in office, or need help to work through treatment. All of those things are very involved. And we believe really strongly that someone should have to be a lawyer to be able to understand these various systems and programs and benefits, but our system is complicated. And so really through events and educational materials and one-on-one assistance, we are providing this education nationwide. We did start as a cancer organization, but what we realized was these issues aren't linked to cancer. And that people with all sorts of diagnoses could benefit from this education, and knowledge is power. And so we launched Triage to try to address it.
Thank you. Monica, any stories that you can think about related to the work you do and the people that you helped and being at the tech?
Yeah, so last week I was talking to an individual and he needed some time off to go to doctor's appointments, and he needed some slight adjustments in his work responsibilities based on what he was dealing with due to his diagnosis. And he called us and he said, I came to one of your events, I learned about this thing called a reasonable accommodation, I went and asked for it, and my job is saying no, but they can't do that. They can't give me special treatment. They have to treat me like all the other people at work. It's like, I just don't know what to do. And so we've, explained the Americans with Disabilities Act, which is the federal law that provides access to reasonable accommodation. We gave him some other examples of possible things he could ask for at work based on what he was dealing with. And we said, go back and actually use the words reasonable accommodation. Because maybe our lawyer didn't realize what it was we were asking for. And so we set up a follow-up call to just make sure that he got what he needed. And we called him back at that follow-up appointment tonight and he said, listen, I'm so sorry, but I can't talk right now. I'm at work. Because he used two words, he was able to get what he needed to then work the treatment. Which he knows he's maintaining his paycheck so he can pay his rent, he can buy his food, and he's maintaining his health insurance. So to me, that I think it just demonstrates the power of having the right information at the right time. Because something so simple as using two words changed everything.
I love that. And I also love that you provided examples too, because I think I've heard stories about just like, well, what do you need? You've had changes in your vision. What do you need to stay in this job? And they're like, I don't know. I don't know what I need. This is all new to me. So I love that you provide coaching and it's examples. It's also giving them language to use, which that's so important. So what about let's talk about any advice that you all may have, and we can start with Tasha. For anyone that has diabetes, for instance, or is managing another current condition, what advice do you want to share for, what could really help them?
Well, maintaining a good relationship with your doctor, making sure you checking with them often about if you're having some issue with your numbers, things like that. Making sure you watch your diet, that is very important because there are other issues that can happen, not just your eyes, but just your overall health and your diabetic. You have to watch your kidneys, you have to watch, all that stuff. And just make sure you remain educated and up to date on things that relate to diabetes. Again, the Blindness.org, that's a great place to start. Just doing a random Google search about a lot of stuff else too. You don't want to make that your health resource. I don't advocate that, but what you should do is just make sure you stay in touch with your doctor. Be open and honest. Sometimes when you go to the doctor, you want to tell the doctor that you made the cake. And that's why you shouldn't just have that. But you have to share that too. You have to share your flaws and things like that so that they can put you back on the right path.
How did you learn them? Was it learning the hard way, or was it to talking with friends and family about, just the importance of being honest, even though it's like, they might judge you or feel like they're judging you?
Well, a lot of my family has diabetes, so it's good to sit there and just go over the things with your family that you're experiencing, having that support, being able to say, like my grandmother was diabetic, and my mom used to stay on her about, what did you eat today? You can't have the candy yams at Thanksgiving, so why? It just keeping each other accountable about stuff too, and just making sure that when you talk to your family, again, you just honest and try to make sure that you continue to do the right thing.
Yeah, and so by extension to your healthcare provider as well. Yeah, thank you. Monica, any advice?
Well, I would say two things. One, I think people need to be really careful about assumptions. So I think that sometimes when someone gets a serious diagnosis, there's assumptions that come into play, whether that's there's something that can help me, or I have to accept the way my doctor's talking to me about things, or that there's no resources out there to help me. Because I think what the reality is, this room is a testament to the fact that there are so many resources out there, you might just have to about it. And again, not to sound like the broken record, but all this power. Ask questions. Use your community to maybe use lots of different things. Maybe it's actual family members. Maybe it's religious organizations that you're a member of a community, because chances are, if you don't know the answer to something, someone else in your community might, or might at least be able to point you in the right direction. So resource.
That's great. And then in your own experience, what would you say are like the 2 or 3 most untapped, unknown about resources that are out there that could really help?
Triage Health.
How do we find it?
TriageHealth.org. And I only say that because what we find is when we teach people about the health insurance system, when we teach people about employment rights, we are talking to people from all walks of life, all socioeconomic statuses, all different job types. Our system is incredibly complicated. So we always think there should be a class in high school on health insurance and finances, because those are 2 things that we all have to navigate at some point. Well, here we have a them. So I think that's certainly one of them, that we all are users of the healthcare system, so they should all have a basic understanding of how to use it. Another one, back to my example, is the Job Accommodation Network. Are you familiar with that? So Job Accommodation Network is an entity that's funded by the U.S. Department of Labor, and their entire purpose is to help employees and employers navigate resilient accommodations. And so they have an online system where you put in your type of job and just what you are experiencing, whether that's a disability or side effects of treatment. And then this search system will actually pop out examples of accommodations that's similar to the situation you want to buy. So to your point, it's like, what do you need? I don't know. Well, let's see. What does a pharmacist who's experiencing blindness, what types of reasonable accommodations might exist? You would be surprised. There are lots of trends we get from people. There's no way someone with that kind of job would do their job with a disability. And then we put it into the Job Accommodation Network system and all sorts of things. So I think those 2 places for information are untapped alums.
Wow, I love that I now know about that, because I'm going to share that like crazy.
Well, now I feel like my job is good for today.
And tell us about any eligibility criteria. Is this open to anyone?
Absolutely anybody. So we provide all of our services free of charge. We are happy to talk to anybody. We don't provide legal representation or the wrong course to somebody, but our goal really is to provide education so that people can take that knowledge and self-advocate.
So thank you, Monica. Thank you. Patricia, where do you now? Share a little bit about any advice that you have.
So I would say to own your health and own your life,
And, I think often we give up all of our power to our providers and we're waiting for them to guide us. And we have so much power and control over what we're doing each day. And maybe we can't, provide the medical interventions that we need, but we can advocate for them, and we can, if we're not happy with what a provider is teaching us or telling us or how they're working with us, there are so many others out there, and you should just let them go and move on to the next person. So it's really, I think, feeling empowered. And if you're struggling to do that, then, again, mental health is so important in all of this. And you have to understand you're not alone, especially if something like diabetes is very common. And there's a lot of support out there for you. And we have to, another thing is, I'll first talk about vision, because that's why we're here. So we have to have our eyes checked every year, and at least. So even if you are not, you don't have diabetes and you don't have diabetes, you still have to have your eyes examined every year. And I think what we don't realize is often chronic conditions are diagnosed in our vision exams. So it's really important to have your eyes checked, because we can see what's going on in there. And to do that every year. And then sometimes your doctor might tell you, okay, you don't have to come back for 2 years, or you need to come back in 6 months. So adhere to what they're saying, because vision loss can happen very progressively and very fast. So you really do need to stick closely with your eye care provider and ask the questions, ask to see your exams, because really if you look at your retinal exam, you can kind of see, they're not really that difficult to read and interpret. Yes, you have to hear processional, but if you want to just kind of look over at the progression over time, you can ask a doctor to watch that, along with it, so that you know and that you're aware. So don't feel like all of this is beyond your expertise or beyond your knowledge, because it's really not. We just need to ask the right questions and work with doctors that will give us the answers, and they're out there. And then again, take care of your mental health. And at the Chicago Lighthouse, I'll just do a plug for our initiative. We have a Cook County funded initiative right now where we're offering free and low-cost mental health services. So even if you don't have insurance or you have expensive co-pays, we are able to cover those. So it is a great opportunity for anyone to come to our facility and to seek a mental health therapist. We also have just look at her in the audience, our mental health care coordinator, and she will go on the training next year, which I think is really fantastic and it's really needed. She'll, she embraces you and kind of just takes you along and gets you where you need to go. So I encourage anyone to take advantage, or friends, family who can benefit from our services, to please sign.
Excellent. Thank you, ladies, all so much. And I just want to reiterate that Prevent Blindness.org, we have great resources. We have a document, actually, both Tasha and Patricia have mentioned it. But it's the ABCDEs of diabetes manager. A1C, knowing your A1C. B is blood pressure, and C is cholesterol. These are all things you want to check and again manage if you have diabetes. D is diabetes control management, and then E is ties. So as Patricia said, get an eye exam at least once a year is recommended. So we have Chicago Lighthouse, we have Prevent Blindness.org, and we have Triage Health. It's great resources. But thank you all so much for joining today.
Can I add to one more thing?
Yes, please do.
I just wanted to say that a lot of what you just mentioned can be monitored so open. There are so many devices that are inexpensive and really worth it to monitor your blood pressure, all the time. You can carry it along with you. So don't be afraid to kind of, again, understand how these tools work and to go out and put your money towards them. You can use flex spending accounts. We have one of those to purchase some of these technologies. So they're available and they're in the environment. And I'm not going to tell where they're actually. I was like, oh, fine.
Over the counter.
Yeah, over the counter. I share costs.
I keep track too. So absolutely. Thank you for that. Thank you, ladies.
Thank you.